Hello, this is Dr. Mays with Health Hub Clinic and Health Guardian Imaging. I want to explain where our dollars are going for health insurance right now. We've all seen the price of health insurance go up dramatically over the last years, and even within our own company, every year it seems like it goes up 8 to 9%. And where is that money going? Because I can tell you as a physician, it's not going to the clinicians. We have not had an increase in our reimbursement rate from insurances in 10 to 15 years. So it's not going to the clinician and it's not going to patient care. So I'm going to show you where your increased costs are going. Right now, we have several things that are playing into this. Number one, the insurance companies are allowed legally to have a 20% profit. So that means for every dollar we pay for health insurance, 20% of it is going to your health insurance company directly to help with the profitability of their company. That's going to big bonuses for high-level people that are not providing healthcare at all. The second thing, 35% is going to administration. We've made our billing process in healthcare so complicated that we have to have a CPT code, we have to have prior authorization, we have to have an ICD-10 code to do anything. To submit that, it requires so much manpower to submit it, to get the prior authorization. We bill it, it gets rejected because there's a mistake. We have to rebill it again. We're wasting money. And that's accounting for 35% of our health insurance costs right now, 35%. So you can see right now, we are already 55% is going from every dollar you spend on healthcare to the insurance companies and the administration costs that are required by the insurance companies. Every bill that is sent out from a hospital or from an imaging center or a clinic has to have an ICD-10 code, has to have a CPT code. Why? Because our government has the bureaucracy and they want us to have that on every exam they bill to CMS. CMS is Medicare, Medicaid, and TRICARE. So we have to have that code on there. Same thing with the insurance companies. They won't pay the bill unless that code is on there. And God forbid you get that code wrong. Because if you put the wrong code in there, you're either going to get penalized or not paid. And so that's what's driving up our healthcare costs, guys. The last thing, hospitals. 20% increase in prices because the hospitals are using imaging and healthcare as a revenue generator. That's why you see these urgent cares popping up on every corner. I know in my town in Springfield, Missouri, there's an urgent care on every corner that's owned by the two competing hospitals. So they feel like they need to put an urgent care everywhere. Why? Do we need that many urgent cares? Because they're making so much profit at these hospitals that they can fund these new buildings that go up everywhere. Meanwhile, if you do the math here, 70%, 75% is going to things that have nothing to do with healthcare. The healthcare cost is getting 25% of the budget for insurance. So when you pay your insurance premium, 25% of that is going to take care of you. The rest is going to red tape. 75% of every dollar you spend on your healthcare costs is going to red tape. Administration, insurance profits, and hospitals driving the costs up. And I think it's important that we all understand that. So when you get that bill from your insurance for a deductible that you haven't met yet, this is where your money went. So you have an insurance policy that maybe has a $3,500 deductible and a $50 copay and 80% coinsurance. That means because your deductible is $3,500, the insurance company pays nothing until you've paid in $3,500. This means that even after the 80 means that even after you paid that $3,500, the insurance company still doesn't pay for it. They only pay for 80% of it. So they're still shortchanging us. The average American will never hit $3,500 deductible in a given year. I've hit my deductible one time in the last 15 years. So I'm spending $1,000, $2,000 a month for my family to be insured, and the only ones that are getting the money is the insurance company and the administration, which is run partially by the hospitals. So here we are, all the clinicians are fighting over this little 25% that's left over, and meanwhile, my health insurance doesn't even cover anything because my deductible is so high. This has to stop. The next video I'm going to show you is how we are going to stop that at Health Hub Clinic and Health Guardian Imaging. And I want to explain it to you exactly step by step so you understand where every dollar is going and you can understand how our plan works differently from traditional health insurance ripoffs. Thank you. This is Dr. Mays with Health Hub Clinic and Health Guardian Imaging.